Hello everyone, my name is Pharmacist Michael, and today I'm going to answer a question that I get a lot. And that is, should I go to pharmacy school to become a pharmacist? I'm going to give you some reasons why it's a great idea to become a pharmacist. And really the reasons are because there's so many things you can do with a pharmacy degree. A lot of people just think of a pharmacist as somebody who is at a Walgreens or a CVS pharmacy behind the counter, handing you prescriptions and giving you advice on how to take your medications. And that is one thing that you can do as a pharmacist. And that can be rewarding, especially if you enjoy people, if you like seeing little kids, if you like to help people. That is a good profession. You make decent money, right? And the good thing about retail pharmacy in particular is you can work 1 or 2 days a week and make as much as a lot of people do working 5 days a week. So if you're a mom and you want to spend some time with your kids, pharmacy is a great profession because there's a lot of companies that will allow you to just work when you want to work. But there's other things that you can do as a pharmacist besides just retail pharmacy. Let's talk about some of those. So there's hospital pharmacy, and hospital pharmacy is different than retail pharmacy. The advantages are you have way more clinical say, really, on what goes on and what the actual drug therapy is. The doctors ask you a lot more questions. It's a lot more intense, I guess. There's specialties you can go into within the hospital, so you might want to be an ICU pharmacist or an emergency room pharmacist. You can specialize in just dealing with babies, chemotherapy. There's a lot of different things that a hospital pharmacist can do. Most hospitals are open 24 hours a day. So there is a chance that you may have to work evenings and nights. That's the downside of hospital pharmacy. But that is the type of pharmacy I really enjoy. I've done that for a large part of my career. And then there's also pharmacy management. And pharmacy management can come in a lot of different places. You can be a manager of a drugstore. You could be a manager of a hospital. That's what I'm doing now. So my job is to keep the pharmacy staffed, look over the profit and loss statements, figure out, how to be more productive, how to save money, make sure the staff's getting along well, make sure people are doing their work, do the evaluations, those types of things. A lot of pharmacy schools are pushing residency right now, especially for hospitals. And I can tell you that I just hired a pharmacist that's not even graduated yet without residency. So it's not true that you cannot get a hospital job without a residency. That's flat out not true. That's fiction. Now, there may be some cities where it's more difficult to do that, but it's certainly not impossible. They've been saying this for years, and I have personally witnessed many pharmacists getting hired without residency. So don't think if you want to work in a hospital that you 100% have to get a residency, because you don't. Another thing that you can do is you can work in academics. So you could be a pharmacy instructor. A lot of people like this job because it's Monday through Friday, 9 to 5. Stress probably isn't as high. You're just teaching pharmacy students how to be pharmacists. And then there's ambulatory care. Usually ambulatory care is attached to some sort of a hospital system. So it would be things like you would work in a clinic and you would see patients like doctors do, except you would help them with their drugs. So you may help them with their anticoagulants, check their labs, make sure that they're taking the right dose, talk to them about their diet. Same thing with diabetes. You may be a hypertension pharmacist that deals with patients with hypertension, maybe HIV. There's a lot of different disease states that have pharmacists that are ambulatory care pharmacist. Again, that advantage is a Monday through Friday job, usually 9 to 5, 8 to 4, something like that. And you get to have one-on-ones with the patients, which is kind of nice. There's compounding pharmacies. So in compounding pharmacies, you make drugs that are not available by bigger manufacturers. So you may have to make creams that don't have certain excipients in them that people are allergic to, maybe certain dyes. You may have to make things that are a different strength. Maybe it's something that is a combination of several different drugs that is not available commercially. And then you run tests on them, make sure they're okay, and sell them to customers. So that's another thing that you can do. That's compounding. There's nuclear pharmacy. A lot of people don't know about this. This is what I did for about 12 years of my career. And nuclear pharmacy is where you make, test, and distribute radioactive drugs for scans. So what are the advantages of this? The advantages are, one, you get paid more generally. Disadvantages are you may have to be on call, which I did not like. You may have to work in the middle of the night because you have to get things ready at night to send out in the morning, so they're at the hospitals at the time when the technicians get there in the morning to run the scans. The other advantage is you really don't deal with the public at all. You go into a lab, you make the radioactive drugs, and you have a staff of people who deliver them to the various hospitals in the area. Another type of pharmacy is long-term care. So this would be where you work in a large pharmacy and you distribute drugs to the different nursing homes, memory care units, places like that throughout the area. As a pharmacist, you would double check the prescriptions that the technicians enter into the computer system, and you would also check the bubble packs. So, the packs that are a month, you just make sure that what the label says is what's actually in there. You can also consult, which I kind of enjoyed, and that's where you go into the nursing home and you make sure that they're doing things the way they're supposed to do. Are the medications appropriate for the patient? You make recommendations based on the age, the renal function, the lab values, stuff like that. And the last type of pharmacy that I want to talk about is telepharmacy. And this is where you work from home, you sign into a computer, and you verify orders from usually multiple hospitals, maybe in multiple states. When I did this, I had 15 licenses, 15 different states, and I was working for about 9 different hospitals at a time, getting orders, processing them, dosing different drugs. Basically what I did was hospital, but there's also, you can work for insurance companies, you can work for retail, I think even has some telepharmacy opportunities. So there are opportunities for pharmacists to actually work from home. Disadvantage is usually not good hours. Usually it's in the middle of the night when other pharmacists don't want to work and they don't pay you as much because they don't have to. People that work from home are usually willing to take less pay. A lot of them might be women with young children. They don't want to put in daycare, so they stay home and they work from home. And it's cheaper for them than paying for daycare for their kids. So there's more types of pharmacy. These are the big ones I can think of. So should you do it? Should you take the plunge and go to pharmacy school? The answer to that question really is up to you, but I would say yes, there's a lot of opportunities and you can work 40, 60, 80 hours for part of your career, and then you could drop down to 3 days a week, 2 days a week if you wanted to. I've always had more than one job ever since I've started, pretty much throughout my career, which has allowed me to make a pretty good living. If you wanted to work 2 full-time jobs, you could do that. Is that a good idea? Probably not. It does give you a lot of flexibility. It's a well-paid job. You are helping people. It makes you feel good when you get done working because you know that you're helping the healthcare system and people in general. If you're interested in pharmacy at all, the one thing that I would strongly suggest you do is go to a pharmacy and try to find one that will allow you to shadow. Because you really want to see what they do. When I went to pharmacy school, I had no idea what I was getting into. I wanted to be a veterinarian. I just ended up as a pharmacist, and it really has been good to me. I've always had a job. I've never been unemployed, and I've always been able to find not just one, but two. At one point, I was working 4 different jobs, not all full time, but you know, some were 20 hours a week, some were just whenever they needed me, some might be every other weekend, but I had 4 different jobs at one time. Find out what you want to do and then go for it. I think it's a great career, and a lot of people like pharmacy also because you're working in healthcare, but you don't have to be around sick people if you don't want to. It just depends on where you decide to work. If you know somebody who would enjoy this video, maybe they're thinking about going to pharmacy school and haven't made up their mind yet, please send this video to them. If you have any questions about pharmacy school, if you want to talk to me directly, leave me a comment or simply email me. I will put my Beacons link down in the description section of this video. And inside that Beacons link, you will find my email. I'd be happy to talk to anybody about pharmacy. If you've enjoyed this video, please give it a thumbs up. And please subscribe to this channel for more happy, healthy living information. My name is Pharmacist Michael. Be happy and be healthy.